Hello, it's Jasmine Mendoza, and from the last adolescent psychology project, I decided to do the infographic on social media and adolescent mental health. Keeping in mind when creating my infographic, I wanted it to be geared towards mostly and mainly parents. I also kept in mind where this would be displayed. Um, so I was thinking about the setting, maybe the doctor's patient waiting area, a counselor's office, whatever it may be. Kept those things in mind when creating it, and again, my focus being geared towards parents. So, and also adolescents, because I don't know if it was just me, but you know, being at the doctor's office waiting, you get bored and you start reading the things that they have posted on the walls. I don't know if that's just something I did, but I also kept that in mind with the imagery and, of course, the information that I'm gonna talk about. So, here's my infographic: social media and adolescent mental health. I started off with explaining what social media is, mainly because, again, my focus was to inform parents. Social media consists of online platforms that allow users to message and video call others, create and post videos and pictures, post status updates, interact with others, etc. Known platforms include Facebook, Instagram, Snapchat, and TikTok. Now, to the right, I included the little logos of the platforms that I just listed, only because, again, my shift or my main focus was for parents or adults, just in case for whatever reason they do not know how these platforms or applications look like. I think it was important to kind of give them a visual. Moving on, I also talked about social media among adolescents, just so that they can get an idea of what they do on here, on these platforms, online. To the left, I have a little picture with adolescents on their phones and little comments above their heads. I thought was a perfect fit for this topic. Social media platforms usually require users to be 13 years or older for them to be able to create an account. And although these requirements are put out on these platforms, adolescents start using these platforms way before. I think it was important to mention that because, again, my focus was for adults or parents to be reading this, and so that they can be informed that adolescents will go way and above beyond to be on these online platforms at such a young age. They even use fake birthdays to be allowed on these platforms, and it's something that they should really keep an eye out for, from personal experience and from what I see around me. So I think it was important to include that. And yes, social media can be a place of connecting with friends and even family, but it can also be a place where there should be caution when using, especially among adolescents. I also, of course, we had to include the effects. And I focus on mainly the big three that at least I personally covered in the previous projects, but also what we covered during the readings and stuff like that. To the right, I have a little two icons, a girl and a boy. They're kind of doing the same thing. They're isolating themselves from these online comments and stuff like that. They seem to be in distress and stuff. Excuse me, sorry about that. So here are the effects. Unfortunately, some adolescents use social media as a way to bully others and a place of social comparison and following bad influences that lead to unhealthy habits. The first one I mentioned is, of course, cyberbullying. And again, since I geared this towards parents, I kind of gave a little definition in the beginning and then kind of what it can lead to if the adolescent experiences these things. So, cyberbullying, the act of bullying someone online, right? Cyberbullying can quickly get out of hand due to how fast things can be shared online. Digital footprint is something to be so worried about. What your adolescent is posting, what they're interacting with, what they're sharing, what they're messaging, etc. It can lead to physical and mental distress on the victim, and repeated cyberbullying can also lead to suicidal ideations. Social comparison. Constantly comparing oneself with online lifestyles and imagery can lead to physical comparisons, right? Things that they see online, whether it be, again, lifestyles. Imagery, I mean, like, people with certain body expectations, certain health expectations, certain lifestyles expectations, anything that follows on that, having such a different lifestyle. This can lead to body image comparisons, of course, right? And it's commonly among female adolescents, but it shouldn't be ignored if it's happening to male, etc. Using these platforms to compare with how they look or what others have that they do not. And in extreme cases, it can cause eating disorders, right? Due to the constant comparing. Lastly, I touched about unhealthy habits. Social media is a place where both, again, positive and negative things can influence others. Social media is not all negative, right? There is positive things that you can gain for it, but it can get addictive to being chronically online. Negative influence can lead to lack of sleep, constantly staying up late, especially nowadays with the TikTok app, scrolling until they fall asleep. Negative lifestyle influence can cause adolescents to want to live up to those expectations and lifestyles. So it can, in not many cases, but it can result in unlawful behavior or, unhealthy habits of picking up, smoking, drinking, vaping nowadays, that sort of behavior. We also had to include data or statistics, and I mainly got mine from an APA article called Teens Are Spending Nearly 5 Hours Daily on Social Media. Here are the mental health outcomes. So the first graph all the way to the left, I'm going to zoom in here for a minute just so we can see a little bit clearer. The light blue is for poor/very poor mental health. Orange is for suicidal intent or self-harm. And then green is poor body image. The article summarizes their data, of course. And among teens with the highest social media use, 41% rated their mental health as poor or very poor, compared to that of the 23% of low users. In addition to that, 10% of the high users reported suicidal intent or self-harm, compared to that of the 5% of low users. And 17% reported poor body image versus to that of the 6% of low users. So I think it's important to see that the more they're using social media, the more they feel like their mental health declines, they're in a poor mental state. I think it's important to see the numbers, actually, and understand how it affects the adolescent. The graph in the middle, it's purple, and it focuses on how much daily hours spent on social media apps. The article does focus this data on just adolescents in the United States, and they're averaging to 4.8 hours daily. So if you think about that, a school day is usually 8 hours, I believe so. So if it's averaging 4.8 hours, they're spending more than half of their daily, day-to-day on social media. And it's also concerning that if their day-to-day is 8 hours and 4.8 is being spent on social media, are they using those during school where they should be focusing on learning and gaining more education, that sort of stuff? Or are they using it late at night where they should be resting for school so they can have, the mind to receive that new knowledge and education? So the popular platforms that the APA article included was that YouTube and TikTok and Instagram were the mostly commonly used. And Instagram accounts for 87% of that time, which I think Instagram in itself should not be an app where adolescents are constantly spending their time. The pattern shows that 37% of teens spend 5 or more hours daily on those said platforms, while only 23% spend less than 2 hours. So there's that comparison. It's almost hitting 50% for those who spend 5 or more hours daily. Lastly, the other graph all the way to the right focuses on the parental relationships and mental health outcomes. I think it was important to include this one, and I like that the APA article actually included it because, again, I wanted it to be geared toward the parents. They have a little core color that, again, stands for poor or very poor mental health, and then a little orange yellow color that stands for suicidal intent / self-harm. The article again summed up their data to saying that the involvement of parental management shows that frequent social media users with low parental monitoring 60% report poor mental health and 22% report suicidal intent or self-harm, in contrast to that of only 25% and 2% of those teens with strong parental relationships that also report that having strong parental relationships and monitoring of the social media use have a protective effect due to them being engaged parents. I think it's important that you actually see the numbers and the data because it's not all just about, the wording and the research. So I think it's very important that the data was included. Lastly, we were said to include tips for healthy usage. And again, I decided to do a little segment for parents and adults, and of course the adolescent themselves. Focusing on the parents, I decided to put down helping the adolescents around you to access social media responsibly relies on you, right? Because again, as young as 13 is the requirement, but there's even younger ones accessing social media. The responsibility is on the parent / adult. Monitoring their usage is an easy way to start. Again, digital footprint is something that parents should be aware about what their kid is posting, what they're interacting with, what they're messaging, who they're messaging, etc. And also keeping in mind the signs of isolation, tiredness, sadness, or anything that I mentioned above in the effects, because this again can give them an idea that their adolescent may be affected emotionally and mentally. And that way they can go out and look for help and hopefully reach a point that their adolescent gets help before, unfortunately, sometimes it being too late, right? And I also included tips for the adolescent because, yes, parents are responsible up to a certain point, but also adolescents should be aware of what they're doing on social media and what their digital footprint is leaving behind. So I put use social media responsibly. Start by limiting your time online. We saw in the data that they're spending 5 hours or more online, and start by limiting it, maybe only 2 or 1 hour each month, even, because I know a lot of adolescents during this generations are unfortunately just so chronically online. It's crazy. But I also put do not share personal information or photos. Again, I put this mostly because cyberbullying, everything can be shared so quickly and it can get so much bigger than, I feel like, bullying in person, not to compare it or anything. But again, the digital footprint can spread so rapidly, so quickly. So being aware of what you're sending, who you're messaging, again, what you're posting, what videos, photos, status posts, whatever it is, to be aware, to not share personal information, to not share personal photos, whatever that may entail. Do not do it, right? Also told them to reach out for help in times of need. Do not feel pressure to live as those online, and to take care of your mental health. I think it's a little reminder that it's okay to ask for help in times of need. It's okay to take care of your mental health. If you are seeing that you're not feeling good within yourself, within your mental health, leaving the online platforms may be the best decision for them. And I also, again, keeping in mind of where this would be displayed, I included in red lettering. In case of a crisis, National Suicide and Life Crisis Hotline, dial 988. Again, keeping in mind where this was going to be posted, I was like, you never know when someone might need that, and they need that information, and I think it was important to include it. Other than that, thank you for listening, and thank you for a great semester. Bye-bye.